How does intubation work for plastic surgery anesthesia? Imagine going under for a plastic surgery procedure where your safety is the top priority. One key part of that safety is how your breathing is managed during the operation. When you receive general anesthesia, your body's natural breathing can slow down or stop, so medical teams need a way to control it. That's where intubation comes in. Intubation involves inserting a flexible tube called an endotracheal tube into your windpipe, or trachea, after you are made unconscious with anesthesia. This tube connects to a ventilator machine that helps you breathe by delivering oxygen and anesthetic gases and removing carbon dioxide. It ensures your airway stays open and secure throughout the surgery, which is especially important in complex or extensive procedures. The process begins with the anesthesiologist giving you intravenous drugs like propofol or ketamine to make you unconscious. They also administer muscle relaxants to relax your airway muscles, making it easier to insert the tube. Using a device called a laryngoscope, or sometimes a fiber optic scope, the anesthesiologist visualizes your vocal cords and carefully guides the tube through them into your trachea. Once in place, the tube is secured to prevent movement during the operation. In facial or neck surgeries, special techniques are often used to avoid interfering with the surgical site. For example, a flexible or reinforced tube might be used, or sutures may be applied to keep the tube in place without disturbing the face. Throughout the procedure, the anesthesiologist continuously monitors your vital signs and adjusts the ventilator to ensure proper oxygen levels and carbon dioxide removal. While intubation is generally safe, it does carry some risks. These include minor trauma to the airway, such as sore throat or swelling, and rare complications like airway injury or changes in heart rate and blood pressure during tube insertion. To reduce these risks, medications are often used to suppress reflexes and make the process smoother. In cases where the airway might be difficult to access, alternative methods like fiber optic or awake intubation are available, allowing the patient to breathe spontaneously during tube placement. In recent years, some surgeons and anesthesiologists explore less invasive options, such as sedation with local anesthesia for smaller procedures. These methods can reduce the risks associated with full general anesthesia and intubation, leading to quicker recovery and more comfort. However, for major surgeries, intubation remains the safest way to ensure your airway is protected and your breathing is properly managed. In summary, intubation during plastic surgery involves carefully placing a breathing tube into your windpipe after you are unconscious. This allows the anesthesiologist to control your breathing, keep your airway open, and ensure you remain safe throughout the procedure. It's a vital part of modern anesthesia that, when performed by trained professionals, is highly safe and effective. Always remember to discuss any concerns with your healthcare team to understand the best approach for your specific needs.